Hey guys, my name's Dr. Rob. I'm from St. Clair Medical and Dental Centre. I just want to give you guys an update on the coronavirus policies and procedures that we've put into place to make you guys just feel a little bit more comfortable for your visit to the centre. So let's get straight into it. So what are we doing? So on the dental side, so we are QIP accredited. Now what that means is that's a national accreditation. Which holds our infection control to the highest level, and that is on a daily basis. That is pandemic or not. So that includes the PPE, so the gloves, the masks, the glasses, and that's not only to protect our patients, but that's to protect our team as well. Now our sterilisation is second to none. I mean, we test our machines daily to make sure that they're working at peak performance. All sterilised instruments are tracked. They are added into patient files, and so we know exactly what instrument was used with what patient at all times, and with indicators that tell us that batch of instruments was sterilised perfectly. Also room maintenance, so in regards to chairs and bench tops and equipment, that is all wiped down with antibacterials, and these rooms are spotless, and this is done after every single patient. So rest assured, on the dental side, we're very well on top of it. Now on the medical side, we've got a few additional things sort of coming into play. Now all patients will be triaged over the phone with three specific questions. Number one is if they've been overseas in the last 2 to 3 weeks. Number two, if they have any flu or cold-like symptoms. And number three is whether or not they've been in contact with a known case of the coronavirus. Now with that, the reason we're doing that and we're triaging our patients now, and same goes for dental, but I'll get onto that a little bit later. Now the reason we do that is we want to stop that bacterial ingress or any viruses potentially from entering the clinic. We want to stop all of that at the front door. And that's on top of our sterilisation and cleaning procedures that we're doing inside the clinic as well. Now, any sort of cold or flu symptoms, we do direct them to, obviously, if we're suspect of any coronavirus influence, to the hotlines and testing centres. But our doctors have graciously decided as well that they will do phone consults with these patients. But anything we can sort of do to help, because we are all in this together. So that's what they're going to do. They're going to do phone consults, and then they'll determine further whether or not we can see the patient in-house or we can offer medical treatment sort of, I guess, remotely through pharmacy recommendations or scripts or whatnot. So that's one way we're stopping it. We're stopping it at the gates. We're making sure that the internal of our centre is completely spotless, and bacteria-free. Now, the other thing we're going to be doing here is we're going to be triaging patients at the door. So the door is going to be locked. Now, there will be a video doorbell at the front. All patients that do turn up will press that doorbell. That doorbell will be wiped after every single touch. And the patient will be triaged again at the front door. Now, again, additional measure to just keep this place safe and sound. Yeah. In general, we've gone a little bit nuts with our cleaning. So all the waiting rooms, the waiting room chairs, they're going to be wiped down constantly. All the high touch areas are always wiped over anyway, but we're going to do that even more. The magazines, the free sample toothpaste that's sitting on the desk, that's all gone for now, guys. I'm sorry. We did stick Netflix on one of the TVs, so we've got a little bit of something better to watch than the constant 24-hour stream of coronavirus news. Hand sanitizers and things will be available for everybody as well. Now, I mean, why are we doing this? The main aim is for you guys to feel comfortable for your visit into the centre, whether at medical or dental. We want to ensure that our centre is following all protocols and procedures and going that next level as well. And if you're still uneasy about it, that is more than okay. We completely can accept that. Give us a call when you arrive in your car. And so we know that you're waiting for us. You don't even have to step in. As soon as that doctor is ready for you or the dentist is ready for you, we'll give you a call and we can walk you straight into your consult room. And then straight on back out as well if you want to minimise your time. That is completely understandable and accepted. If you are a high risk patient, particularly on the dental side, so we've got any immunosuppressed patients, so those that may be undergoing some cancer treatment, or particularly the elderly, of course. If you don't feel comfortable about coming in for your dental treatment while there's patients in the waiting room, we are looking at seeing any high risk patients after hours. So the way that would work is it would only be one dentist, so either myself or Sadia, with an assistant, so only 2 people in the practice. No one on the medical side, no waiting room. Now, what would happen is you've got to call up the clinic. If you think you're eligible for this, is that's 84631388. Dial number 2. You'll speak to Erin or Morgan. Let them know that you're interested in this option, and they'll determine that sort of on a case-by-case basis, and we'll get you scheduled in, and we can get your treatment done like that. And we do have another entrance as well if you didn't even want to pass through the waiting room. So we've got a lot of things in place to make you guys feel comfortable. But do rest assured that we've left no stone unturned on this one. We're really hitting it hard, and I think as long as we're all sort of diligent and we're all a little bit smart about it, we keep in mind the social distancing, proper hand hygiene, so soap and water, hand sanitizer on the go, but soap and water is important as well. It's a relatively easy virus to kill if we're very diligent on our hand washing and things like that. So as long as we're all smart about it, we're all looking after each other, I think we'll get on top of it, and before we know it, we're going to blink. We're going to be down the road somewhere, and we're going to talk about that sort of crazy thing that happened in 2020. But look after yourself, guys. That's me. That's just an update of our policies and procedures. So don't be too concerned about coming in. Any questions? Of course, give us a call. 84631388. Send us an email if you like. That's medical at stclairmdc.com.au or dental@stclairmdc.com.au. More than happy to touch base with you guys, whatever makes you feel more comfortable. That's me signing out. We'll see you soon. Bye, guys.